how to counsel a patient for surgical procedures. Extremely important, and I request Dr. Gaurav and Dr. Himanshu sir to take it from them.
That's probably going to take all of us to chip in with something or the other because it's such a big thing. Anyway, I'll try to put it briefly because I've already spoken enough. But so when it boils down to surgery, I think let's look at cataract surgery because that's probably what we advise the most, unless you're Dr. Grover. But so when it comes down to a cataract, so I think patients, so you have to build that trust. The patient should be able to trust you. If you have a patient, who sits down the first thing and you don't ask his name and you don't, look at him and, you look at maybe the workup slip with the optometrist has sent you and you notice that he's diagnosed a cataract and you tell him that operation ki zarurat hai, I think patient will probably think that, dekha bhi nahi hai mere ko, and, he's outright advice. So first thing is that, again, the niceties should not be ignored. It takes just few seconds to talk to the patient and acknowledge their presence and maybe have a, cursory look at the relative and say hello to them. And then, maybe what you're doing anyway. You probably know that the patient has a cataract. He's probably carrying a prescription which clearly tells you. Spend 2 minutes to look at the patient on the slit lamp with a torchlight and, try to probably see and ask them that which eye do you see less with and what is your complaint? Why have you come here? That's about all that is required. And, in that 1 minute, patient knows that you have kind of understood his problem. And then you can, go ahead. Now, there are some patients who have already come to you seeking surgery. So there, the thing has become so easy to kind of go ahead with. And there are other patients who probably don't even know that they need a surgery. They have a cataract. So as Dr. Grover sir said, you have to let it sink in, So you can tell them that, okay, you have a cataract or whatever, and we are going to check you further and look for, so many patients appreciate the fact that you are probably checking them thoroughly. So we usually tell them that, you get a dilated exam and then I'll tell you whether I already see a cataract, whether you're going to need a surgery or not. We'll decide based on your investigations. And, we'll see you once again after half an hour after you had these few things done. So the patient comes back, he gets time to think about it. And when he comes back to you, and then you can probably show him some of the reports. For example, nowadays I do an eye trace and that can tell me, it's included in our package for cataract workups. They have the dysfunctional lens, this thing is there. We also do a, disc photography, and that clearly shows one eye with a clear media, another eye with a very hazy media. It becomes very easy for you to kind of explain to the patient. As Shreyas said, you can show them the reports and, then they trust you more. And when they trust you, you can kind of advise the surgery, but never impose on them. Like, you always have these patients who tell you that उन्होंने बोला कि आज ही operation कराना है, कल ही operation कराना है. Okay, so you can tell them that cataract surgery is elective. You can take your time. Delaying it may cause problems for you, but if you decide to do it, please come back. So give them time to think and also give counseling to the relatives.
I said, Gaurav did it very well. I said the bread and butter to survival is this question. All that you have done, you have spent 30 years in your undergrad, postgrad, and everything is for that exam which you can't afford to fail. Those 5 minutes decide where you pass and fail. So it's nice when a patient comes for a second or third opinion. They have the diagnosis in their mind. So you're not giving them anything new. That makes life a little easier. But the problem is when a new patient of a cataract comes and then you discuss you have a cataract and then he'll say, "नहीं मुझे तो सब दिख रहा है क्योंकि एक आंख में नहीं दिखता है, दोनों आंख से सब दिखता है." So you have to make them understand what is the difference.
Right. I think sir has a dodgy connection there. Somashela ma'am, in an institutional practice, what would your take be? Like, how would you counsel your patient for a surgical procedure?
So first of all, one myth that I would like to bust, and it's sort of thought about that at institutes we're not really very chilled out. We're not really looking to convince the patient for surgery. That's not true. We definitely want to operate on the patient if the patient desires or there is an indication for surgery. So I would, of course, Gaurav has pretty much picked up everything about when you want to look at the patient for cataract surgery. He's mentioned all the points. But my way of convincing the patient would be that, so we get a lot of patients of all strata. We get the patients who cannot afford surgery, and they know that we do it at no cost. So there's no convincing there. They've come for surgery, we're doing it at no cost. So there's nothing that we need to convince. And we have the very high-end patients who they have access to just about everybody in India or overseas, and then they come to us, and then we spend a lot of chair time with them, and they're the ones that we need to convince, and that we approach just like how all the very top-notch private practitioners you have in the panel over here today would probably approach those patients. So we have to tell them everything about what lens you select. And then after that, it's I wouldn't show that I really am desperate or something like that. I just kind of, this is it. And, if you'd like to go with it, I'm very, very happy to do your surgery. And I'll do the best and do my best to give you the best results. And that's it. We cannot really coerce the patient or keep chasing the patient beyond that. And the convincing part is required for those patients who are between the super rich and the not affording. And these are the patients sometimes they're sitting on the fence. Should I get the surgery done now? Should I wait? So I realized to my bitter experience that even glasses cost 25,000 rupees. So nowadays, if the patient wants to wait for surgery and says, "Give me glasses or change my glasses," I said, "No, you're going to wear these glasses for 6 months, maximum to a year. You spend the 25,000 on getting an eye surgery done." And I even sometimes show the bill. I pay 27,000 for these. So they're very convinced in that way. So simply when you show the patient that you actually sort of are thinking about even their finances, it's very easy to convince the patient. And we also get those patients who say that humko bola hai, that we have to get surgery done today or tomorrow. And so those patients have come for a second opinion. So and then I say that the doctor is actually right. You do have a cataract, but it's a cataract. So they may be right in a way that, if not today, you need the surgery tomorrow. But it's up to you. You want to get it done now, you can get it done. So we don't really, don't try to coerce the patient. That's what I would like to say. They'll come to you.
Dr. Rishi sir, your opinion in view of transplants or DALCs that you do, sir?
So, I mean, this is applicable to any surgery. If you have good staff, like optometrists, if they are well trained, when they see the condition itself, they can prime the patient a little bit that, you've got this and you might need a surgery. It gives the patient time to kind of process that by the time they reach you. So that's one tip I'd like to give, that if you train your staff well to pick up on, based on their clinical judgment, if the patient has decreased vision and he's seeing a cataract there and it looks like their cataract is commensurate with their vision, or if the patient has an ectasia and is a very young patient, is likely to need cross-linking, the optometrist level itself, they can start telling them a little bit that, I think this might be what you have, but the doctor will confirm when he sees you, and you might need a small surgical procedure. These are things that they do for this. So if the patient can start to be educated before your room, I think it becomes easy when you are talking to them to convince them to have any particular procedure, whether it be a corneal procedure or refractive or cataract, whatever it be. So if you have periodic training sessions with your optometrist and even your secretary who's, kind of bringing the patient in, if they can kind of look at the file and tell them in between while they're putting drops, whatever. I think those things help a lot.
Dr. Grover, sir, your opinion on how you're going to counsel a patient. We know, sir, that it's got a lot to do with the soft touch and just the way, your tone in which you're talking to the patient, and you are a master at that, sir. So if you could please share your experience on this.
Everything has been said very, very well, with the Dr. Himanshu Mehta particularly pointing out in his first introduction, he said that if you are convinced about a procedure, then it's very easy to convince the patient. I think that is the crux of the thing. If, say, for example, I almost routinely do a bilateral surgery for a unilateral severe ptosis, and most people tell me, how is it possible to convince them? But you are convinced that that is the right procedure for the patient, then hardly ever a difficulty. The same holds true for any of those refractive procedures or particularly your high-end intraocular lenses. The day you are convinced that you're doing the best for the patient, it's not difficult for you to. So that conviction for you has to come first. The day I'm convinced that this is the best procedure for it, I'll find it very easy to convert the patient. The second thing I wanted to say was that you would all have attended the symposia from the companies where they tell you how you can build the atmosphere to have more patients convert to multifocals or to torics or to trifocals or whatever. So yes, they are all useful as a part of your understanding of what goes into the decision making of the patient. They are all valuable inputs, but don't be just taken in by that hype. They are commercial organizations, but you are the person who's really going to deal with a human being, and you have to make sure that you are giving them the best, and you are going to face any difficulties that they have later. You are the interface. For the company, it's a product which has gone out. The numbers have increased. But for you, it's every single patient who needs to be happy. I used to say in government service that we had one master to answer to. Here I have 100 patients, 100 masters to answer to every day in a practice. So you have to make sure that you get it right almost every time. So which is a huge ask. And therefore, don't let that hype color your thinking, and be sure that for this patient, that is the right procedure, and that right balance between doing the right thing for the patient and, well, of course, financially you want to be viable, but the right balance where patient takes priority. I think that.
Thank you so much, sir.
Rohan, I just wanted to mention, sir said so beautifully, something very, very important. I talked to the general manager. I said, you get paid and I'm working for the company. We are selling their lenses, we are selling their equipments, and we are paying them money. On top of which, all the EMIs. They travel business class, you are still going Janta class. This is the unfortunate part of medicine, what he said, So we are selling their equipment and we are selling their stories. So they may want us to be selling more lenses because you are just one more product. Gaurav ne itna use kiya, Dr. Grover ne itna use kar diya, Dr. Mehta ne itna, this month my sales target were reached. You are just a conduit, a small pawn in the whole game. So you have to be convinced what you are doing and telling your patient. They should be genuinely be benefiting by that. All those lenses which are bundled with various equipments, not necessary that you have to sell them. Be very righteous. These are the things available. This is modern technology. You take a call. This is something very important.
Right. So, Dr. Shreyas, your closing thoughts. Everybody's discussed cataract in detail. You do a lot of refractive surgery as well. So, what about refractive surgery counseling? Because we know that the patient has to be extremely motivated to get a refractive surgery done. That's like the first thing that you learn in refractive surgery. Touch only a motivated patient. So, what are your thoughts on that?
Yeah, actually, motivated patients don't require much counseling. It's really about explaining to them what options, and they are there to just choose from your options. What actually has worked for us across our network in all our branches is that I think I'm also paraphrasing what Dr. Rishi also mentioned, is that we have a very good, effective team of very well-trained optometrists. And these optometrists initially make that, lay down that initial conversation of even to a patient who may not really be very interested in, let's say, refractive surgery or a cataract surgery, telling them that, you may require a procedure or you would benefit from such a procedure. Why don't you get some details before you meet the consultant and ask for the advice? Then they go to counseling. Counseling is also across our branches are done by senior optometrists. And because they're senior optometrists, they have the clinical angle of it. It doesn't look like they're selling a product. It is not, they're not, talking about price or talking about the economics of the entire thing, but actually trying to tell them from a clinical viewpoint what is necessary. All of them use a lot of visual aids, a lot of videos, and we try to customize the videos as much as possible to each center so that the videos which are shown are made by us, not something which the company has provided and this thing. So, the patient is more drawn to it, more attracted to it than, let's say, a generalized advertisement. This definitely lays down the path for your initial, the thought process has gone that way. And then when they reach the consultant cabin, despite all that, whatever has been advised, I still believe that it's very important that when the patient steps into your consulting room, that we ask them why they have come or what has brought them here today. And even though they might have already undergone a cataract workup and cataract surgery, fixed a date for surgery, some of them will say irritation. They may not really complain of defective vision. And it's really important that we address that complaint along with the surgery or this thing, because that goes a long way in ensuring the patient feels that you're going to give a more wholesome treatment to them and makes them trust you even more. I think having that system in place, a standardized system, I think replicating that standardized system across with all patients helps a lot.
Excellent. Shreyas, you've spoken so well on everything. I just wanted to add a small thing which I probably forgot to mention, and it's come across as everybody has spoken. That so many times, the mental block is in our mind, especially when offering a premium procedure or something like maybe a contour vision or a smile or maybe a trifocal lens or, femto-assisted cataract surgery with trifocal or whatever. I mean, high price procedures. And so many times, you should not judge the patient by how he looks or how you think is the patient. So typically, even if there is a poor patient or there is a well-off patient, I will usually tell them that, there are several options today about lenses. You have the lens which will give you only distance, and then you'll have something which can give you there. So many times I'm, kind of surprised that a patient may opt for a star toric ICL or he might opt for a smile when I thought that he would probably just get an SBK done. So I think that many times that block is in our mind. So we should probably also not judge a patient, and when telling them, if you're telling them truthfully about all the options and then leave them to decide what they want, so many times you'll be kind of, taken aback by how many of them will opt for something which you never thought they would.